A couple of things before I start my talk. I have been very lucky, not just because I got a position in Australia, but because I was not seeking applications, or I wasn't applying to places where there was a structure to an application program. Basically, I'm lazy. I did not want to give any exams, so I chose Australia is my answer. I also say I was lucky because I was lucky to be mentored by a few people. I'm going to show you those people in the slide. And as I am an anterior hip surgeon predominantly based out of Mumbai, in my first anterior hip case, which was on the 22nd of February 2022 in Bombay, it took me 6 hours to finish that case. And all those 6 hours, David Roda, my mentor, was with me for those cases. So like Nandan mentioned before, these lifelong bonds, they do exist. They do help you in transitioning to a new system, taking a new technique elsewhere. So it does all, contribute to your development and betterment. So I'll just start off with a few disclosures. Thanks. So I work as a consultant for these 3 firms. They have no relevance to my current topic. These were my mentors. So my first year of fellowship was in Sydney. I applied during my residency. I did not wait for my residency to complete. I'll tell you a little more about my journey and how I was even luckier to get into the program in the first place. But Suleiman was the guy who taught me something known as Superpath. You guys who pursue hip would want to know a little more about other techniques of doing hip replacements. And this was something I went for to Australia in the first place. So in my 1 year of fellowship, all I wanted to do was learn Superpath, didn't care about anything else. Then decided to call back home and, the suppliers of the instruments, and realized that they had wound up operations in India in 2019. So that was a big bummer. Unfortunately, COVID happened, but I got stuck in Australia, and I applied for David Roda's fellowship position, and that's what really changed the game for me. So I started doing anterior hips with David in 2020. I was a fellow with him until 2021, and 2021 to 22, I was a consultant at his practice. So my journey was just like every one of us. I did my D-Orth, finished in 2017. I finished my DNB in 2019, but even before I finished my DNB, I secured a fellowship position. So you do not need to finish your residency programs to pursue fellowships in Australia. Big plus, all right? So you can apply at any stage. For guys who are noting down details, there's a QR code at the end of this slide. You can just take a photo of that. So you will have the whole presentation. It will help you a lot. Luck didn't favor me in my DNB. I ended up having an argument with my examiner, true to my nature, and I failed the exam by 1 mark, which was a lesson to me. But I still got an opportunity to pursue this fellowship. So you do not need to have DNB or MS to pursue fellowships if you're backed up really well in your CV. So I'll give you those details as well. Now, why did I choose Australia? One, it was a very easy transition. Australia is a really accepting country, and especially nowadays for Indians, it's very easy, very open to move to Australia. The diaspora is very used to the population of India. About 5 million Indians live in Australia, so it's just like home, except not like home. Orthopedics in Australia is really nice. It is a very good level, not just arthroplasty, but sports and spine and tumors. There are dedicated institutes, which are the training centers in different states, and they do really well. And I also wanted to experience living in Australia. I have half my family, which is based out of Australia. So I thought, why not? Why not spend some time in Australia and see if I like it there? The first couple of months in Australia were a bit of a struggle, because you're accommodating not just to orthopedics, but also a new way of existing. So living life in a different country is also a lesson, and it will be something that you will find it difficult to transition to. Honestly, Australia is very easy, because English speaking, number one, is a very big advantage, plus a lot of Indians. So transitioning is not that tough. Systems are easy, but you still, take a couple of months to find your feet. Second, when I started doing my fellowship, I was comparable to the fellows in Australia. So the local trained surgeons versus you. And when you get the knife in your hand, and if you've not used it in India, it shows. And that's what was my case, it showed. In my first fellowship, I got 12 hip replacements to do in my entire fellowship. And I could not be disappointed about that because I really didn't know how to do Supapath. I didn't know how to do a hip replacement surgery before going there. So you have to be honest about your own skill sets before you sit into interviews and before you apply for these positions. Whereas when it came to knees, I ended up doing about 60 to 70 odd knees in my first year of fellowship, which was a great start. When you're doing 5 knees a month, which is pretty good, you get your hands running. How I landed that position is very interesting to understand. There is no structure to applying for a fellowship in Australia, which has its advantages, but it also has its disadvantages, which will be discussed. So there was no mentorship, there was no guidance, and this is when I'm talking about 2019. Now people know that there are ways to apply, there are websites that you can go on to apply, which I'll mention next. So what I did was I sent individual applications to everyone on those websites, and everybody kept saying no. But I kept following them up, and I kept asking them how I can make my life better and how I can get a position in those systems. So after making those mistakes, I realized that I really should not be trying to give them what I have, but what they're seeking. And that's where Dr. Kenny, Dr. Marathe, everyone spoke about the importance of research in your CV. No amount of recommendation, obviously it is mandatory to have recommendations, but unless it's a part of their system, hold the same amount of value. So recommendation from India works really well in India. Recommendations from Australia works really well in Australia, but it does not skip continents. So recommendations of India may not work the same way that an Australian recommendee would help you to gain a position. So in your CV, what really stands out is PubMed indexed research articles. By the time I finished my residency, I had 10 PubMed indexed research articles. So I didn't do a lot of cutting, but I did a lot of research. So maybe something to work on that you should be doing. IELTS is the only exam that you need to give before going to Australia, and which was the saving grace for me and the reason why I applied to Australia and not the UK or the US. IELTS academics is what you have to give. It's a fairly easy exam to give, and it's a fairly easy exam to score a 7 band in. What that does is, once you give that exam, you show your commitment to that position. You show your commitment that you're keen to come. So when you write your application letter, these details stand out. These are the UAE Fellowship Directory and the AIMS Fellowship Directory. There's another one, My Fellowships, but it does not really have so many good application institutes, but the first two have a lot of them, about 100 of them. So you can send in emails to all of them. I would urge you to submit your applications as soon as you can. The applications are just letter of intent, should have 4 or 5 paragraphs. 1, introducing yourself. 2, what you did in your residency. 3, what your targets are, and 4, that you intend to come back. You're going to get a fellowship position in Australia if you intend to come back, and they're going to get you to sign that form, because if you intend to stay there, the cycle parallels what happens in the UK. It's a Commonwealth country, everybody has the same cycle. So you're going to invest 5 to 7 years. I know people who have got into the system and have become orthopedic surgeons and are orthopedic surgeons who have done their MS in India. But if you're going to commit 5 to 7 years of your life training and not knowing where you're going to end up, for me, it wasn't worth it. Okay, so this is a very subjective choice, but that's what you have to really work on. The paperwork, as Nandan also mentioned, is tedious. It's about 6 months of paperwork. All the documentation that happens in Australia is helped by those guys. So you don't have to do anything. You just have to pay the money. And all the documentation that happens in India is all your headache. That starts from getting your MMC good standing certificates to your DNB good standing certificates, or whatever the documents are. So that takes a lot of time, and everything there would require a little bit of effort on your part, but generally 3 to 6 months is what you're looking at. You get your visas and you go home. So basically there are 2 registering authorities in Australia, APRA and RACS. You don't need to get onto the details of either one of them. You just need to get a certificate from them saying yes, you can come to Australia. All they check is if your MBBS certificates are valid or not through the ECFMG registration portal, which is standard for all countries around the world. Now, what my expectations were in my fellowship and what I got out of it is something that I think this is where the titration job begins, right? We have to understand that for us, what we think is fellowship's going to be fun and hunky and dory and everything's going to be great. I'm going to start cutting. It doesn't work that way. You have to show your commitment because those guys really want to see if you're capable enough of jumping levels. It's a different level of practice. You need to have fun. Fellowships are great time, and especially my time in Australia was probably the best time of my life, apart from working in Jupiter Hospital under Dr. Ashish Phadnis, which was great. But I got to do a lot of skill acquisition, but that wasn't restricted to just orthopedics, right? I got to learn the business of orthopedics, the art of orthopedics, and that mentorship is something that you're seeking along with just cutting. So understand that part of it, and I think a lot of us really work towards establishing a practice and who don't come from a second-gen orthopedic family, these sort of things would really help you from a system like Australia, which is private and public. So when you know how to deal with those patients there, you bring the best, give it to your patients, and there is a distinction that's created, and that really benefits your practice as well. I also got to steal in some cases and acquire in other cases a lot of protocols and some things that we're not good at maintaining protocols. So I have a protocol, like a whole black book of all the surgical equipments that I need for every case. I can do to some extent about 45 surgical cases. Hip replacement, knee replacement, IT fractures, each one of them has my surgical protocols. I never had those protocols before, never had them in my residency, never was exposed to them. But in Australia, every surgeon has them, and I could acquire it from them, and I have it in my practice. So I operate as a freelancer all over Mumbai, and I just have to take that book and say, these are my requirements. So these are things, small things that you really gain from when you're in a fellowship which is wholesome. I was a very responsible adult, as you can see on the left of your screen. I had a 5-day working week, which was OT, OPD, and wards. My ward association was very limited because my fellowship supervisors were like, all right, you don't need to put in as much effort into your ward. You can talk, you can communicate, spend more time in your OT, acquire those skills, and that will elevate you. So this is the rapport that you're able to build, and especially with Australian surgeons, they're generally very, very chill, so they're easy to communicate with. On-calls are only in public hospitals, so I had fellowships which had 8 hospitals that I was working at simultaneously with my bosses. 4 of them were private, where I was assisting them, but 4 of them were public. So I would go to the public hospitals, I would operate there, I would be the fellow there, I would get my on-calls, and I would get paid for it as well. I had an academic meeting, which I hated, which was at 6:30 in the morning every week, but I think we all have to do these things even out here. Again, they're calling you there for what they can get out of you. In those 2 years of fellowship, I could publish 3 papers, which is not great, but considering the transition that you're going through, and if you're still able to publish a few papers, it's ideal. So 1 a year is minimum, but if you can publish a few more, it's great. Now, what are the cons? It's not all hunky and dory. Like I mentioned before, taking up a fellowship abroad, you will straight where we come from, and we all understand that all of us are not at the same standards because not all of us come from KEM or Nair or really good institutes. I'm not from KEM. I did not get the acumen that I should have in my residency, and that really hits you in your fellowship. So I think that understanding, if you can have at this point, it'll be great for your career. I didn't have it. I only learned it when I was there that, hey, you know what, if I don't do a good job for them, they won't let me cut. So you have to learn on the job as well, but nobody in Australia expects you to know a knee replacement or a hip replacement before getting there. They expect you to at least know how to open, get inside as they are sipping coffee in the second room. So if you're able to do that, and if you're competent to do that, that's a good start for your fellowships in Australia. Once you get in, they're going to come in, they're going to be like, all right, go to the next stage. And that's how you'll progress. Nobody's going to handhold you, but if you're able to prove yourself in these small manners, doing a good draping, being nice to everybody. I think that really counts. The thing I struggled the most in my couple of years in Australia was, even though that I really enjoyed my time in Australia, was I felt like I was a foster dog. I felt like this was a great home, but it was never my home. And that's the feeling that you will have wherever you go if you're really fond of the systems out here. And once you overcome that and you finally fit into the systems, whether it's the UK, the US, Canada, or Australia, you realize that those systems are really made for those people. And they are made really rock solid for you to get into. So having that understanding that, at least in Australia, that you will have to come back is a very good start. Because you're going to spend 2 to 3 years of your life, make a lot of money, save a lot of money, but you have to come back and work here. Because getting into their programs is a very difficult task. And at most, any Indian surgeon would get a partial comparability. So there are 3 outcomes of your comparability testing. You've done your fellowship in Australia and you decide you want to be there and you want to stay there. You apply to RACS. And RACS says you have 3 options. Either you're uncomparable, you're partially comparable, or you're fully comparable. You're not going to be fully comparable in Australia because their basic requirement is you need to have a training course of 4 years minimum before you get full comparability. And there are other requirements as well, so 300 cases in the past 5 years, whatnot. So understanding that you're just going there for a fellowship for a couple of years and coming back is good for a start. These positions are now very competitive because everybody knows that now there are no exams to get into Australia. It's a little easier than going to the US or Canada or the UK. So everybody applies to Australia. So even the Europeans apply, and generally they get a little bit of a preference ahead of us. It is what it is. So you should start applying though. That's very important. Once you reach there, it takes about 6 to 12 months for you to really find your skill set, no matter what your subspecialty of choice is. Initial investment is about 5 lakh rupees. You're going to spend at least 5 lakh rupees to land in Australia. That requires all your documentation, which doesn't seem to be a lot of money, but for somebody like me who was just out of residency, it was a little bit of an investment. Almost all fellowships pay anywhere from 80,000 Australian dollars upwards, which is quite a decent amount to exist. If you reach 100 and 100 plus, you make enough money to save when you come back home. And long-term prospects, as I said, opportunities are limited. You guys will have to retrain if you move to Australia, but again, that wasn't a choice that I wanted to make, so I came back home. My advice would be, by the time you've ended your residency, you already know there are 2-3 subspecialties that you're interested in, or if you're not out of Mumbai and if you're out of some other part of the country and you're going back to, there is a void and there's a need, apply for those fellowship positions and then try to come back and pursue that subspecialty. Rejections are going to happen. I got 54 rejections before I got accepted for the first time, so I think it's a record. This is a very independent place. You're going to have fun, but it's also where you start your practice. So consider your fellowship as a state where you're practicing independently, because in Australia, you will be considered an independent practitioner and you would get a license to practice. Small things matter. Individual emails, proper grammar, CV, and your research. Research is very important.